Greetings and welcome to Healthcare Leadership Live. My name is Mike Lyons and I'm your host for Healthcare Leadership Live. And I am super excited today to be talking to a new friend, Barbra Dey. Barbra, thanks for coming on the show.
Oh, thank you, Mike, for inviting me. I'm excited to be here.
Well, absolutely. And your picture behind your head kind of gives a clue here to what we might be talking about and what we will be talking about. And that has to do with the optical, the everything related to optical and the eye care field and how we can optimize that. And so if you would just tell us a little bit about the work that you do so people can understand, the perspective that you're coming from.
Absolutely. So I work typically with MD and OD practices all across the country and basically help them with business operations on the optical side of their business. So basically working with them to maximize profitability, making sure that they're always in line or the decisions they make come back to the mission and values of that business. So we're not operating in one way in the optical and in a different way in clinic. It all is one visit for the patient, and we're tying it all in together to make sure that patient has that exceptional patient experience. And then from the business perspective, that's great. We want to make sure the patient has a great experience, but we also need to make sure that this is a profit center for our business. And so really looking at that in terms of what are we doing? What could we be doing better? Are we looking at our how we price things? Is it in line with the market? What vision plans are we on? There's just lots of different aspects we dig into and then come up with a plan to actually maximize both revenue in line with the patient experience, working with optical leaders or administrators of the practice, and indeed with the optometrists too, of course.
Yes, and you know a little bit about providing eye care yourself, isn't that right?
Yes, I do. My background is actually in optometry. I grew up in Ireland. You may still hear a bit of that accent in there, but I've been in the US now almost 30 years. So this is home. But I did start out here working in ophthalmology and really, went back and took all of my boards, my national boards for optometry. Unfortunately, wasn't able to get licensed because of the schooling I had in Ireland, but used that experience to really work with practices on the technical side and develop technicians. And I got very involved in the medical side, actually, of ophthalmology before my kind of second career and moving into optometry as administrator. And so did that for many years and then decided, you know what? I loved ophthalmology. And I was like, I want to take what I've learned here and bring it back to ophthalmology to show them how they can really grow their optical businesses. Because I did see, across many different practices that, oftentimes the optical is kind of like, oh, that's just, we have that there just for our patients in case they want glasses. But there wasn't enough attention been given to the optical department. And oftentimes opticians felt like, oh, we're just the forgotten people over here in the corner. And sometimes they don't even feel part of the business of the bigger ophthalmology clinic. So my goal is one practice at a time to help these opticals be recognized and be regarded highly as a very, a significant profit center for the business overall.
Well, as an HR person, I know that when people don't feel like they're part of the bigger mission and they don't feel valued, then that's when they start to have more turnover, less engagement, less performance, not producing as much. And it's just kind of overall a bummer. And so, some of the stuff that you've talked about, the comment that you made specifically about not feeling part of the clinic, can you elaborate a little bit on why that sometimes happens with the optical team?
I think it happens because when we think of ophthalmology businesses, we really think of clinic and surgery. And historically, surgery has been I suppose, the revenue generator, the large revenue generator for these businesses. And a lot of these businesses, especially the ones that we work in, are privately owned by ophthalmologists. So they're in their swim lane, and they have, administrators working for them that typically have come from that same type of background. So I think it's more related to they're working where their expertise is, and have forgotten a little bit, like, oh yeah, we decided to have an optical, but have forgotten that, like, this needs nurturing as well. And maybe I, as an ophthalmologist, don't have that expertise, but I'm smart enough to employ somebody who does, and who can run that as a business entity. And I can start holding them to account for the performance based on published benchmarks, right? So I think really that's why it's been driven primarily by private ophthalmology teams that are focused on what generates their revenue.
This makes me think, I recently wrote an article about how when you manage your staff, that's different from how you manage the managers in your clinic. You have to have different expectations, different process, and different things you think about. And so now I'm wondering, you kind of made me think about, what is it that, let's say you're an ophthalmology practice. Where do ophthalmologists, you think, get tripped up, in thinking about how they manage their medical ophthalmology and optometry versus how they look at and hold accountable and take care of their optical, which obviously just neglecting it was kind of the first thing, but when they think about managing and cultivating it, what are some of the blind spots, no pun intended, or mistakes that they make when looking at that?
I think the biggest thing I have seen is that, and this happens really across all different departments, but we promote from within, right? So let's say we have a star optician, right? And we need an optical leader. So we promote that person to optical leader. Great. But there's a couple of things we've forgotten. One, not every star optician is a good leader. That's the first thing. And that's really, really important, because we're all different types of personalities, and some people are doers and they're very task oriented, and leaders are more global and they can see what needs to be done. They've high EQ. They're great at dealing with people. So that's part of it. Now, the other part is, when we promote somebody from within, we have to level up their skills. They were used to working with patients, taking care of patients, dispensing glasses, educating patients on the best options for technology and all of that. They didn't know how to run the business. They didn't necessarily know, well, what are benchmark reports? Well, what do you mean average revenue per patient? Well, what is that? Oh, what do you mean negotiating with the labs? We can negotiate with labs. So you only know what you know, right? And I think the hard part in ophthalmology is, when you elevate an optician, you typically, they're reporting up to either an operations manager, or maybe in a smaller practice, it's the administrator, right? But often these administrators or practice managers are also very heavily educated on the clinic side, and they themselves do not understand the business of optical. So it's so important, if you are in that situation, that you find somebody like me, or somebody who understands the business of optical, to educate the administrator on what it means, what they need to look out for, how they need to hold their optical leader to account, and how they can level that leader up. And I can tell you from our experience, one of the businesses that engaged us in the last year and a half, we're still working with them, was a new administrator who clearly said, I don't know optical. I don't know the questions to ask. I don't know what this leader should be doing. I just don't know. Can you teach me? Right? And so, and it's really worked out, because that business has grown. Their average revenue per patient went up $100 over a year, just because people now know what's expected of them.
Wow. Yeah, expectations are critical there. When you look at the business, of optical, and you talked about maybe someone is coming in as a leader of the whole business, and maybe they don't have experience in the optical world. Maybe they've never worked in eye care, and they've have some other healthcare background. What is a mistake that someone like that might commonly overlook, or what's something they might often just not understand that's different about optical than other healthcare, or just maybe an ophthalmology office they've worked in the past?
Well, when you think of optical, there is, the expertise of the optician and the technical end and all of the wonderful lenses and the new technologies coming out. But it's also a retail part of their business. It's retail. And when you think of retail, it's a fashion part of their business too, right? People want to look good in the glasses they purchase and the frames that they purchase. So there's that whole aspect of the business. And also, like, there's this, especially with the trends today, there's like, how do we make it easier for people to do business with us? Can they go onto our website before they come in and see our doctor and kind of look at some options and say, oh, put that in my cart. I might want to look at that when I get into the office, right? So there's this whole retail marketing fashion part of this business, which is quite different from your historical ophthalmology business. And how do you keep up with trends, and how do you stay relevant in this world today? Because it's, as you know, it's ever changing. It's ever changing. There's new things coming out all the time. Do we have the technology that supports us in running this part of our business? Or are we just always scrambling and entering something over here and then entering something over here? So lots, it is quite different, right? In that sense, there's a lot of different things to think about. And I would say the primary thing is, fashion, retail, ease of doing business.
Certainly the fashion aspect is a vital. You've got salespeople there.
Yep.
In the optical, they're not just fitting you for a medical device, right? Glasses, contacts, but there's a element of, how do you want to look? And as a fairly new glasses wearer myself, I can empathize with that. It's tough to find the right look.
I think it's another skill set too. Opticians, across the country, there's very different levels of opticians, because some of our states are licensed and some of them are not, which means there's a certain level of education required in certain states. And in others, it's, I can come in from the street having known nothing about optical. I can be trained from the ground up without a license and work with patients, right? But so the technical part is really important, and educating or training our opticians to understand the technical part is so important, because it goes in line with choosing the frame. Because if I'm somebody with a very high prescription, I don't want to have a big, huge frame where the lenses are going to look ugly, even if I get the thinnest, lightest lenses possible. So we also have to know, so what face shape suits what type of frame. That's one thing. What will look good? And then we have to know a little bit about the personality of the person. Do they like something fun, outgoing, lots of color? Or do they like something that's a little bit more, reserved or not seen? You have to learn about the patient and their lifestyle and what's important to them, right?
Yeah.
And I will say good opticians are really good at looking at your face and saying, I know exactly what to put on that face. Right? Yes.
Okay. Well, I might have to get your help next time. This show is sponsored by Seasoned Advice HR Services, where I help clinical healthcare businesses to make more money and save more money by hiring better, retaining better, and reducing your HR risk. if you would like an HR assessment or ongoing HR support, please reach out to me at seasoned-advice.com. You talked about the optical office being thought of sometimes as just kind of like, well, it's just there if someone wants glasses. But can having an optical department actually lift the entire clinic in a way? Are people underappreciating the capacity that it has for the office?
I think so. I really believe that's true, because if you think of it in terms of a patient experience, right? Say I come in and I come in because I'm just not seeing as well. Now, I may have some other things going on, like maybe I have glaucoma as well, an eye disease. And I come in and I'm seeing, the technician first, then the optometrist. Most likely the optometrist would be seeing me. The optometrist is, I will say a lot of optometrists working in the MD, OD environment are optometrists who are very passionate about the medical side of optometry. And that's why they gravitate towards those type of practices. That's why they're not working in OD only practices or Costco's or Walmart's or whatever. They're passionate about the medical side. And this is where they can use that education and see those type of patients, right? So the optometrist may focus on like, okay, glaucoma, let me make sure she's on the right drops. Let me make sure her visual field looks good. Let me make sure this patient is getting the care that she needs for her glaucoma. But they may forget, yeah, I've got glaucoma, but I came in because I can't see and I need a new pair of glasses. So that might become secondary to that optometrist. And what I would say is that it's so important that we really listen to our patients and take care of the whole patient, the whole kit and caboodle, right? So basically, if I came in for glasses, yes, you found glaucoma. Yes, that needs to be addressed and taken care of. But please don't forget that I also want glasses. And the best thing that an optometrist can do for that patient is provide them with a recommendation for the glasses that they believe will best suit their lifestyle in the optical. Because now we have a complete patient experience, right? So the patient is now transferred from the exam lane to the experts in optical, who will teach them and educate them on what the possibilities are for them to get their best visual outcome. Now, optometrists don't need to know the nitty-gritty about this lens, that lens, everything else. They just need a global thing. This patient needs a pair of progressive lenses, and I'm going to transfer you to our optical experts who will go through everything with you and educate you on what's available for you. And I think that's really important, because there's a couple of things here. If that patient, if the optometrist stops in the lane and says, here's your prescription, go get your glasses wherever you want, right? If she says that, or he says that, and the patient doesn't even think to go to the optical, they walk out the door, they go down the street, they go into another optical, the glasses are made up, then the patient goes back to pick up the glasses from this second place, then the glasses aren't working, right? Now we've got, it's fascinating. What the psychology behind this is fascinating. Who do you think that patient blames because those glasses aren't working? They actually blame the doctor. They blame the optometrist, whether that's right or wrong. It could easily be that those glasses were not made up to the specs that were given to them. It could possibly be the design of lenses were chosen poorly for them. And then it could also be there was an error in the prescription, the way it was written, whatever, right? But if we keep that in-house, now the collaboration between our opticians and our optometrists can move to solve that problem together and make sure that patient gets this great experience. Because it gets more challenging when now we're dealing with the optical shop down the road, and it gets back to us, and it's like, well, he said, she said, no, it is made up right, no, it's not, it just adds in complexities. So keeping those patients in-house is typically a better patient experience.
Do you think that if a clinic has a mix of medical optometry, ophthalmology, Maybe they have oculoplastic or retina, and they've got an optical team. Is it better for them to have a dedicated optometrist who is just there to see those patients that want, glasses, contacts, and just that person is a specialist on that? Is that a better decision, you think, or is it better to just have those optometrists, all of them, be having that, as part of their process?
I mean, that's a great question.
Mm.
Me personally, I think they all should be able to see these patients, because when we start pigeonholing, it gets really complicated from a scheduling perspective.
Mm.
It's like, okay, I can only schedule with her if it's a vision plan patient. And then I got to go over here if it's a medical. Oh, but this one's
Mm.
medical and vision. How do I do that? It actually adds a lot of complexity to the whole scheduling process. And I also believe our employees who are screening patients and taking phone calls, scheduling, have a really difficult job today. Their job is complicated, and it's complicated by the amount of insurance plans out there, and what each one's allowed, and how should I put a patient over here, or is this a vision exam, is this a medical? It's so complex that if we're to add another variable in there, I just think it makes it too challenging. And we also know that optometrists are trained in that whole framework: medical, vision. They're trained in the whole thing, contact lenses. They're very well trained in all aspects of this. And yes, they may have some preferences or some things that they're very passionate about. And they may have like little specialties. Maybe they're doing myopia management, and this is the doctor that is the best at myopia management in our clinic. But I think if we keep pigeonholing them too tightly, it'll be very complicated for our support staff.
That makes total sense. And I appreciate you thinking about the staff impact there. I'm wondering, thinking now about strictly financial. If I am looking at a eye care clinic as two halves, let's say
Yeah.
like the medical side and all of the costs that go with that.
Mm-hmm.
We've got doctors, salaries, staff salaries, and then we've got revenues, right? Claims. Then on the other side, optical, maybe, different costs, right? You've got product costs, you've got staff costs still, but maybe lower staff costs. You're not paying a doctor in the optical team.
Mm-hmm.
Can an optical team, can it have as good or maybe even better return on investment than just a strictly medical side?
Yeah, it's super interesting. I'll give you some statistics from, let's talk about an optometry business with an optical.
Mm.
So in optometry businesses with optical, the majority of the net revenue typically comes from the optical, right?
Mm.
So for example, in my past life, when I was administrator of this business, 60% of our revenue came from the optical. Sometimes between 60 and 65, and then 35 came from the clinical side. And let me tell you why. So the reason is, one, that vision insurance plans reimburse quite lowly on the clinical side, right? That exam reimbursement is not very high. Now, they have a benefit on the optical side, but if we can educate our patients about premium products, then the co-pays on those premium products and the overages for those patients really, really drives our revenue forward, right? Now, if we're giving patients what's covered, our optical business is going to tick along, but it's not going to be extremely profitable. I think the other aspect of that is, so in ophthalmology, by the way, it's way lower. It's lower because we have MDs seeing patients in clinic at, from different insurance plans that have higher reimbursements. We have visual fields going on. We have injection. The injections probably counted separately, but we have a lot of different testing going on. Exam reimbursement is higher from a medical insurance than it is from a vision insurance. So all of those things contribute to the clinical profit. And historically then, our surgical profit was higher again, right? But those days are over. Let's be honest. Reimbursement on the surgical side for cataract surgeries has gone way down. And if we don't own our own surgery center, we're really not making a ton of money on that unless we're able to educate patients on premium IOLs. And now that supplements the income coming, the revenue coming in from that. On the optical side, we still have so much potential for revenue, generating revenue outside of vision plans. And honestly, in ophthalmology, if we look across, I'll take like the clients that we work with, most of those clients are in network with, let's say, 2 vision plans. Now, if you're in network with 2 vision plans, typically they'll take the vision plans that are reimbursing at the higher rates, right? You typically can do very well with that, very well. And then especially if you position yourself when a patient says, oh, you don't take my insurance. If you have a really good response to that, it's like, we take every insurance, Mrs. Jones. In your case, we take yours as an out-of-network provider. And let me explain what that means to you. And for you, we give you this discount. Mm-hmm. And we will submit it to your insurance company and they will reimburse you. So if we change how we approach our patients, instead of saying, no, we don't take your insurance, we say, we take everybody. We want everybody to stay with us. And here's how we're going to help you stay with us. And here's how you're going to be delighted with this experience. And you're going to be delighted with the eyewear you receive. And you are going to get great value and benefits from your outcome with us here today, right? So it's a lot of educating, training, and being more global about looking things. In ophthalmology practices, I know the revenue can be about 30 to 35% of overall revenue contributing to this business if you give that side of your business some attention.
Yeah, and I don't know that anyone can pass up, the potential for revenue and profits, right? We've got to find different avenues. I was wondering about, the proliferance of e-commerce, optical avenues these days. Yeah, I'm not going to tell you where I got these glasses from, but I know that people buy a lot of glasses online these days. And you kind of alluded to clinics maybe trying to wedge into that e-commerce market a little bit. How are you seeing clinics sort of compete with those maybe lower cost or maybe higher convenience e-commerce sites to try to capitalize and recoup some of those dollars that people might, try to take elsewhere?
Yeah, great question. So e-commerce is here and it's here to stay, right? Now, let's talk about it in terms of, let's say I'm a 20-year-old and I have a single vision lens and I'm like, oh, I'm on the website for Warby Parker or Zenni or one of them. And I thought, that looks really cute. Click, right? I'm going to get that one with my lenses, right? And they come back and you might be happy. Now, you're not educated at this point. You won't be educated on what does a really good anti-reflective coating and anti-glare coating mean? What is that going to look like after 2 months? Is your vision going to be good enough? Probably for a 20-year-old, it's going to be just fine if it's a low prescription, if it's a very basic low prescription. What's the quality of the frame like? Well, maybe they don't even care about the quality of the frame because they just bought it for half nothing and they can get another pair in 6 months, right? So there's all of those things going on. That's true. Now, on the other side of that, we have patients going up there who may need more complicated prescriptions filled, right? They go and they get it and they're like, it just doesn't work. So actually what happens is some of those patients will go back to their local optometrist and say, can you check these? I got them online and they just stood up. And it's actually an opportunity for that practice now to create the loyalty, to do a really good job and to educate the
Mm.
patient on what was possible for them. You just got the plain little CR39 lenses. No one, that's that's for yesteryears. It's not for today, right? You have an anti-reflective coating that's already cracking and crazing, So they get the opportunity to educate them, and they get the opportunity to create a loyal patient. Because I can tell you, experience matters. Experience in anything we do now, it matters. And if we can build a relationship with that patient, and that relationship starts, by the way, from the very first phone call into that business. If we can develop that relationship from each touch point on the patient journey and into the optical, trust is built along that journey. And the doctor is one of the most important people in that trusting relationship, building that trusting relationship. If that doctor, really believes that this patient is going to get a better experience if they explore opportunities within their optical, that patient will believe them, right? Because they trust their doctor. And if I'm the optician and I sit down and I take time with you to understand, how do you use your eyes every day? What does it feel like for you? Where are things falling short for you? And what about this? And educate you on what's possible. Now I am really building that trusting relationship, and I'm building loyalty. And you don't get loyalty online, right? You don't get loyalty online. But having said that, like, we can't ignore e-commerce. We can't say like, oh, it's not coming, let's just close our eyes and not do anything about it. We have to also be creative and say, look, we also can have our e-commerce site, so you can shop before you come in and see us, and then we'll talk to you and we will sit down with you and go over everything. Or it's like, oh, I just want a pair of sunglasses. I don't even need a prescription. Maybe you have a lovely range of sunglasses on your site, and you can say we can ship them to you, or you can come in and we'll adjust them and make sure they fit you right before you walk out that door. So we can use it to our advantage in the eye care world today, and ignoring it is not the right answer.
I can totally picture what you're saying. If an optometrist, ophthalmologist, says to a patient, we've got a great team here, and there are so many, products to choose from, and they're going to make sure that this thing that sits on your face every day is going to be optimal for your lifestyle, for how you work and how you move, and we're going to make sure that it's done right. And you can't get that from Warby Parker. Wow, you're exactly right. That's a powerful comment right there.
But Mike, what's interesting is Warby Parker realized that, because now they have brick and mortar stores, right? Because they realized they needed both.
Yeah. So yeah, there you go. Even Warby Parker and its millions and millions of revenue said, we need people who can do the refraction, sure, but they can hand that off, and boom, you've got a vertically integrated process. And now we're already here. We have the optometrists, we have the instruments, we have the inventory. We can do that. We just need to execute at the same level. Learn a few things from Warby Parker. They're not ignoring their optical department. They're paying very close attention.
Yeah, I mean, they do incredible marketing for sure, and that's where they throw all of their money, which is well done. I would say where private practices have a little leg up is the education of their staff. What I've seen is a little bit superior. The education and training, and also the products that they are recommending to their patients. The technology is not the same.
Right. And I'm wondering if there's probably some integration between medical ophthalmology and, if I just go into a glasses shop and you don't know anything about what's going on with my lenses or my retina or whatever, that's probably different from you've got an optical team that really understands the medical, stuff that's going on with that patient, that customer, and they know it because they swim in those waters all day long.
I think you're right. I think that it's not universal. I would say some of the more experienced opticians absolutely understand and know how to look at the chart notes. And we're like, oh, yeah, okay, this person says they can't see perfectly. Well, they could never see perfectly. They've got macular degeneration. So you can't, just because we're getting glasses here, I can't fix that. So I think there is a percentage of opticians who would know that. And then there are some that don't. But I can tell you this. If you've got a really good collaborative team, clinical team that collaborates with the optical team, that's where the power comes in. Because if I'm an optometrist and I take time to say to you, you know, I sent Mrs. Jones over for glasses. I just want you to know that she actually will never see better than 20/40 out of her left eye. And I don't know if you can see that in the chart now, but I just wanted to give you a heads up. So when she comes in to pick up her glasses, that you can mention that to her. This is the best possible vision we can get for you today, Mrs. Jones. When those relationships between the doctors and the opticians are collaborative and tight and they know each other, that patient experience is just so much better. It's really, really fantastic. Yeah. Yeah.
Well, Barbara, I've really enjoyed chatting with you about this topic. It's something that I have really only begun to understand, and you have spent your whole life and career doing this. So thanks for spending time with me today.
Listen, it was really fun, Mike. Thank you for inviting me. Yeah, I loved it.
How can people get in touch with you if they want to work with you to strengthen their optical or their eye care, operational efficiency?
You know, they can connect to my website, which is dayophthalmicconsulting.com. They can also connect with me on LinkedIn. My profile's up there along with my email address and phone number. So both places you'll find all that information, and always delighted to help out. Even if you just want to just run something by me, happy to do that. I do 30-minute complimentary consults all the time with potential clients, and often find that it's very fun. It could be something very simple. I'm happy to answer for you.
Awesome. Well, I'll put the links to your website and your LinkedIn in the show notes.
Well, that brings this episode of Healthcare Leadership Live to a conclusion. If you enjoyed this episode, please subscribe to the show on your podcast app and share it with someone who would value the content. I promise to bring you more guests and content to help make you a better healthcare clinical leader. I also invite you to subscribe to my HR newsletter for healthcare leaders. You can find information about that at seasoned-advice.com. Now go out there and lead with confidence.